Hello, this is Crystal and I'm going to be working with Maida. We are both students in the DMS program here at Southwest University, and we created a short video on how to scan and go through the carotid artery protocol that's on the screen. As you can see, it consists of a right and left side of the CCA, which is your common carotid artery. We included the subclavian and innominate artery as well. You'll be seeing Myra's scan, and throughout I'll give a quick explanation on the images she's obtaining and how to obtain and evaluate these vessels. So one of the first arteries that branch off of the aortic arch is the innominate artery, or the brachiocephalic, which is the little pink vessel there at the bottom. And this vessel or artery further divides into the right common carotid artery and the right subclavian artery. And the left carotid artery originates slightly to the left of the innominate artery, so there is no left innominate artery. Here you see the right innominate artery for the brachiocephalic. Myra's probe is sagged to the vessel, and it is placed along the clavicle bone, kind of angled in. You'll throw your color and you'll evaluate, and this will be your pulse wave with a nice open spectral window. You kind of use the clavicle bone as like a guide to kind of just follow along and slide into the right subclavian artery. You'll throw color and your pulse wave and have that open spectral window as well. Here for the CCA prox, you're moving superiorly on the neck. You're going to see the jugular vein, so you're going to use your dual screen to get the CCA in two planes, in transverse and sag. And you're going to adjust settings to make sure you get a nice anechoic lumen, and here is the dual screen. You're going to turn on your color in sag, and you're going to adjust settings just to fill it in. From there, you can create an angle and pulse wave. You might need to steer your box and adjust your pulse wave gain just to get your waveform and to get that clear spectral window, as you see here. And you're going to measure your peak and your end diastolic. Here, Myra's just making sure that she's entering her measurements and her velocities into the calcs correctly. And from here, you're going to move into the CCA mid. You're going to go back to your dual screen to get the two planes again, your transverse and sag. So the CCA mid is just a movement superiorly up the neck, above the CCA prox. To give you an idea of the vessel that you're evaluating right now, it is the green one. And the CCA mid would be approximately kind of where the label is. And again, you're just going to do your dual screen, two planes, and make sure your settings are adjusted to have an anechoic vessel. Here you're going to turn on your color in your sag and kind of create an angle, because it's going to help you whenever you pulse wave. You may need to invert or steer your color box accordingly. By getting the vessel to be open and filled with color and avoiding bleeding, you're helping your waveform be more accurate with the velocities that it's reading. So here Myra's just adjusting her settings to get a clean waveform like the one you see here. Okay, and then you're going to take your measurements, your velocities, and enter them into the calcs and move on to the CCA distal. You're going to go into transverse and just move slightly above the CCA mid. Here you can see Myra go up and sees the bifurcation and goes back down. This is how she knows that she's in her distal CCA, because it's right before that bifurcation. And you do your dual screen, transverse and sag of your CCA distal, and you'll be obtaining an image like this. And from there, go back into 2D Sag. Throw on your color, steer your color box if you need to. Create an angle with your probe so that way when you pulse wave, you can get a nice waveform. And here is the waveform and the velocity for the right CCA distal. After the distal, you are going to keep moving superiorly. You're going to reach the right CCA bulb. The bulb is going to be the very ending of the green before it splits into the yellow and the red. This is where the CCA bifurcates into the right internal carotid artery and the right external carotid artery. So for the bulb, Myra identifies her CCA, moves her probe up until she sees it bifurcate into two vessels, comes back down, and obtains her two-plane image of the bulb. Here in the image, you can see how the CCA distal looks like it's widening. This is actually the bulb. And you'll throw on your color. In the color image, you can see the CCA distal becoming the bulb and how it fills. And you're going to turn on your pulse wave, adjust settings, pulse wave gain, and measure your velocity. And you're going to enter everything into your calcs. So the bulb was the ending of the green, and now Myra is going to evaluate the right external carotid artery. And as you can see, Myra is going to find the bifurcation where the bulb becomes two vessels. And typically, the ECA is the smaller of the two, and she's going to turn on it. The only way to know for sure if you're evaluating the ECA or the ICA is to pulse wave both. They're both going to give you two very different waveforms. But here Myra followed the smaller vessel to the ECA and angled towards the face. And she's going to turn on her color. You're going to see the color flow is right after the bulb. And when she pulse waves it, the ECA is going to give her a high resistance waveform with a sharp upstroke and a sharp diastolic as well.
I added in a comparison of the ICA and the ECA so you can see the difference in the waveforms and how the ICA is low resistance.
For ICA, Myra is just going to angle towards the back of the neck because your ICA is providing blood flow to your brain. So this is going to give you a low resistance waveform. With the waveform, you're going to see a swift upstroke and a gradual and longer end diastolic. It looks different from the ECA, so that's how she knows she's on her ICA prox. And here Myra is obtaining her velocity, and I'm going to save it into her calcs and moving to her ICA mid. For the ICA mid, Myra's just going to keep her probe in Sag and continue superiorly. Again, your probe is angled towards the back. And here's your ICA mid, color, and she's gonna go ahead and pulse wave. You're still gonna have your low resistance waveform with the gradual diastolic and diastolic. And now Myra is going to locate the ICA distal, very close to the jawline. Here she's trying to get as much color as she can. The higher up that you go, you might need to apply a bit more pressure to get a clear waveform. She's adjusting settings, making sure it comes out nice and clear. After the ICA distal, you're going to do your right vertebral artery. For the vertebral artery, Myra's going to go back to her CCA mid at the level of about the thyroid. She's going to turn sag, and she's going to angle in. You're also going to add some depth possibly, because the vertebral artery is going to run between two shadows. These two shadows are your vertebrae. So you can see here the arrow is pointing, and the two shadows laterally to it are the vertebrae. Along the way, Myra is adjusting her settings, and when she gets color, she may need to turn down her scale penetration of the machine to allow her to get some color in the vertebrals. There it's a slight color fill, and she's gonna adjust her settings so she can pulse wave. And it's very faint, but she's gonna adjust her settings so she can clean up the waveform. And it's very small, but there it is. From here, Myra just moved on to the left side and started the protocol with the left subclavian artery, because there is no left innominate artery, and just completed the protocol almost the same as the right, with your 2D images, your color, your pulse waves, entering everything correctly into the calcs. Along the way, she's using her probe to create an angle, to get a nice color fill, to get a nice waveform with an open spectral window, adjusting settings. And from here, the left side is pretty much like the right. You have your left CCA mid, you go into your distal, your left CCA bulb, then your left ECA, your left ICA prox mid and distal as well. And here's the report that was completed after the exam. You can see that there's the right and left velocities for each vessel that Myra evaluated. These velocities were recorded in the calcs, as you saw her calculating and putting them in. Underneath the chart, you can see the ICA-CCA ratio. This ratio is obtained by dividing the highest peak systolic of the ICA and divide it by the mid common carotid artery velocity. A ratio greater than 2 suggests an abnormality, and anything less than 1.5 is considered a normal ratio. You should also include if any elevated velocities were seen, if there was any plaque within the vessels. And you can see there at the bottom, Myra separated each vessel and documented that she saw no elevated velocities and a slightly elevated left CCA. Anything above 125 is considered an elevated velocity. And for each, no plaque seen throughout. And that completes the exam. I hope you found the video informative and helpful in going through the carotid protocol. And thank you.